Welcome, good morning, good afternoon, good evening, wherever you are tuning in from to the Delivering NCD Services series. And we're beginning today by looking at some of the burden, the challenges, and some of the support that is actually available to deliver this at the country level. Now, let me start off by saying my name is Waqanivalu, and I work for the Department of NCD here in WHO headquarters. If you look at this slide, you can see the equity that non-communicable diseases bring. I am from Fiji, and for someone born in my country, your risk of dying from a major non-communicable disease between the ages of 30 to 70 is depicted here. It's about 31%, compared to if you're born in Japan, Republic of Korea, where it is 8%. Now, some of the reasons for this is related to NCD services. And when we did this report in the primary health care on the road to UHC in 2019, you will see that NCD services is quite lagging behind. And if you look at the non-communicable disease line, you will see that it's relatively flat, so not much improvement as compared to the other programs that we have. So there is a bit of a way to go. Now, COVID-19 has now exemplified this in quite a negative way, impacting people living or affected by NCD. We've talked about the deadly interplay that COVID-19 brings because of the high susceptibility of those with underlying condition, mainly those with non-communicable diseases. Dr. Tedros put it correctly by just saying COVID-19 has sprayed on people living with non-communicable diseases. As such, when we received requests from WHO member states, the 194 of them, one of the number one requests for technical support has been to integrate non-communicable disease into primary health care and UHC. So this represents the demand that they have, realizing the lack there has been in the progress as far as NCD is concerned. Now, what do we mean, or what do they mean when they're actually requesting integration of NCD into primary health care and UHC? I've put here the definition of integration health services: the organization and management of health services so that people get the care that they need. And I highlighted people because it's not about programs, not about anything else. It's about really the people receiving the comprehensive care that they need that doesn't jeopardize their financial or economic standing. We've put here the framework of what integration is that we're looking at. We're integrating within the whole NCD services, prevention, management, different disease areas, brought together so that we deliver this care to the individual interacting with the health system, but also NCD with other health programs, and ultimately the whole of this to maximize the impact and outcome together with the health system. Now, how do we do it? There's a framework that has been developed with 26 evidence-based strategic action that we are working on, but generally there is about 3 areas. We strengthen the upstream policy initiatives. We engage the service provider. This has been brought about quite in a significant way with this work that we are doing on this global good. And then the human resource and capacity interventions that are needed. And we've got 26 evidence-based strategic action to actually make this happen. Now, what would it take? You are aware of the different building blocks that we have for health system strengthening. And I've listed here some of the support that WHO will provide to you at the country level to be able to get this moving. Because unless the health system is strengthened to deliver on NCD, then the services may remain patchy and not really being scaled up and scaled out. So in these areas, we could assist. Now, realizing that these don't exist in a linear fashion, we've shown here in this schema that these are interrelated, that by improving a strengthening of a system in one component actually lead to a strengthening on the other. So in a way, it could have some multiply effect if we do that with a specific focus on non-communicable diseases. Now, coming down to what can you do? There's 3 actions we are advocating for. One is, and this depends on where you're at. I think the first one about advocating for system strengthening efforts to deliver on NCD, that having technical programs is not enough. We need to make sure that the health system is able to deliver. Your advocacy in doing that would be great. Number two, you can actually, if you are, depending on what level you're in, you can actually act on parts of the system that needs to be strengthened. Whether you be a pharmacist working in terms of access to medicines, whether it be health information, or even at planning level, how do we make sure that the system is actually strengthened to deliver an NCD? And thirdly, if you're at a point of decision making, that maybe you indeed can influence to make sure that this is actually done to be able to deliver a non-communicable disease services. If we do that, we will see that line that we've shown in that report much better in the years to come, and ultimately get the people who really need the services to be receiving them as we define in that integrated health services, and leaving no one behind, as the UHC always depicts. So thank you for listening. Watch for the next couple of sessions where we dig deep into some of the specific areas of the system, but all in all, to help deliver NCD services to those who need it the most. Thank you very much. For more questions and queries, we have our contact down below that you can email to, and we'll be more than happy to interact with you. Thank you very much.